Invisalign is a way of straightening teeth. There are many options when people have crowded teeth. There's of course traditional braces, which we can see here. Traditional braces is usually metal on metal, so we've got metal brackets with a big piece of metal going through and metal tying all that together. And of course metal braces have actually been around for a long time. Invisalign is actually a computer generated way of getting the teeth straight. So we take models of the patient. Those models are actually scanned by a computer. The computer then, through CAD/CAM, will actually move the teeth so that they're all straight. And a sequence of aligners will be made. The aligners actually look like this. They're actually clear, so you can't actually see them when they're actually worn. They do need to be worn at least 22 hours a day, so that's all the time except when we're eating food. And the number of aligners, which are changed every 2 weeks, depends on how much the teeth need to be moved. What actually happens is they're clipped onto the teeth, so you can see here, if I clip it onto the model, you can see that you can hardly see that the Invisalign is actually in place. I'm going to show you Courtney, who is one of our Invisalign clients. Courtney's a young girl who's a uni student, and there's her smile. So her main complaints is really, of course, the space between her teeth. The teeth are very irregular. We'll go for a close-up view actually of the teeth so that you can see the space in here. And what we're going to be using is we're going to be using Invisalign to move the teeth. You can see that there's small buttons that are placed on the teeth. The buttons are there to allow Invisalign to actually move teeth. There's a certain amount of torque and rotation that we need to do with teeth to move them. And the buttons are just white filling material which have naturally removed. You can't see them when you actually from a distance looking into the mouth, but they allow Invisalign to actually work faster. Invisalign, once it's in the mouth, actually looks like this. You can see it here when you're in close-up view, but from a conversational point of view you would never be able to see them. You can see that the buttons are actually there, and the Invisalign is just placed over the tops of the teeth. Once Invisalign has actually been used, you can see the spaces are all now closed. Getting towards the end of the treatment, the bottom of the teeth are fairly straight, and what we're going to do is use actually the last few retainers that do the last little bits of tweaks before the case is finished. Once the case is finished, usually what happens is we finish with some whitening, and we of course take all the buttons off. So we see some of her after shots here. That's the case when she's done a bit of whitening and the buttons have all been removed. Teeth are very straight now, and there's a photo of Courtney with a beautiful smile.